Hi guys, welcome to my channel Pulmonaria. I make short and concise videos about important medical topics meant for quick revision. Today's topic is Lichen Planus. This is categorized under papillosquamous diseases, and in my previous video I've told that squamous means scaling. But this disease does not have any scaling. There is no scaling present in this condition. This also, like pityriasis rubra pilaris, it is also a T cell mediated autoimmune condition, and the antigen here which causes all this is still unknown. But there are some triggering factors to it. What could be that? Could be some drugs like ACE inhibitors, or it could be gold, which is important, and could be other drugs like thallium, or it could be some infections like HCV virus, like a human hepatitis C virus, or a hepatitis B virus, or it could be some mercury amalgamation as seen in this picture in a dental filling. This is the mercury here. What are the clinical features of lichen planus? There are characteristic 5 P's involved in this. That is, it is purple in color, it is polygonal in shape, we can see in this picture, and it is on top of the lesion, it is planar, and these are the papules that we can see, and these papules are extremely itchy. That is, it is pruritic in nature, which is nothing but itching. It is more like a rubbing itch. We can see all the 5 characteristics in this picture, which is, it is papules which are purple in color and polygonal in shape and planar at the top, and these are present on the flexor aspect of our body. There are 2 characteristic features seen in some of the lesions. These are called as Wickham striae. These are nothing but thin white lines seen on the surface of the lesions. We can see in this picture these white lines. There is also something called as Brock's phenomena, wherein when we scratch a lesion, there is subepidermal hemorrhage points, and it also shows true Kubernetes phenomenon as seen in this picture. What is Kubernetes phenomena? When there are new lesions in the site of trauma, and here the trauma we are referring to is the itching, or it could be any trauma as for that matter. Actually, it's not itching, it is in the site of trauma. There are other sites which are also involved in lichen planus, that is mucosa, nails and hair along with the skin. What are the mucosal lesions? These are nothing but violaceous, meaning they are big lesions. These are of lacy reticulate pattern. We can see in this picture the lacy reticulate pattern in the mucosa. Now there are 2 types, asymptomatic and symptomatic. Asymptomatic has no risk of developing squamous cell carcinoma, whereas symptomatic one is called as erosional These have burning sensation in it, and they have a risk of squamous cell carcinoma. Another thing is the nail lichen planus. What we see here are these longitudinal ridges in the nails, and some thickening of the nails. This is typically called as onychohexis. Pardon me if I'm wrongly pronounced or speaking it. Onychohexis. What we see here is this tent shape or winged shape projection of the skin onto the nails. These are pulp tent shaped or winged shape called as the nail pterygium. Of course, we have heard pterygium in ophthalmology, but there is something called as nail pterygium as well. If this nail pterygium continues, if it is chronic, it will lead to permanent nail bed loss. The hair LP we can see in this picture is a very big lesion. These are also very violaceous lesions leading to permanent hair loss. There are permanent hair loss. Coming to the histopathology, first we'll discuss the normal skin pathology. In this lesion we can see the dermis. This is the dermis of the skin, and this much is the epidermis of the skin. Now in the epidermis of the skin we have stratum basale layer, then we have the stratum spinosum, then we have the stratum granulosum layer here, and then we have stratum corneum, and there is one more layer, stratum lucidum, present in palm and soles. What we see here in lichen planus is that there is increase in the layer of stratum corneum. This is called as hyperkeratosis. Then there is increase in the layer of stratum granulosum layer called as hypergranulosis. We can also see increase in the stratum spinosum layer, which is called as acanthosis. Along with that, we can see is the liquefaction of basement membrane. This. Along with that, in the basement stratum basale layer, if we consider this to be a cell, there is vacuolization and there is apoptization of the nucleic body. This is called as a civet body. And also we see in these are the neutrophilic infiltration in dermis layer. The deeper layer of dermis is spared. And a very classical we also see here is this. The rete ridges are sawtooth shaped. Hence the histopathology of lichen planus. Coming to the treatment, it is a self-limiting condition and it heals with hyperpigmentation. In mild to moderate cases, we can give the we can give is topical steroids. Also, we can give tacrolimus. In very severe cases, we can give oral steroids and dapsone to decrease the inflammatory reaction. If you liked it, thank you for watching. Have a good day.